A new CBS News YouGov poll reveals that only 36% of those surveyed believe the government's efforts to deal with the coronavirus have been, quote, going well. This as several experts are warning that more mutations and variants may be on the way as a result of Omicron's faster transmissions. Here to look into what lies ahead is Dr. Melan Han. She's the chief of pulmonary and critical care for the University of Michigan Health Systems. Good morning, doctor. Want to circle back with the new variants down the road, but let's start with what's happening there in Michigan. The White House recently sent military medical teams to help Michigan as well as 5 other states. What are you seeing there, and how are hospitals faring with this surge?
Yeah, that's right. We really have been struggling here in Michigan. We actually had a Delta surge before the Omicron. So Biden recently sent 120 military personnel to the 6 states. Up to 1,000 has been promised. We desperately need them. Our hospitals are absolutely bursting at the seams. We have to remember today is Martin Luther King Day, and Detroit in particular has been hit very, very hard. While Detroit has 7% of our state's population. They've had 25% of the cases and deaths. So it's just something really important to remember. We're hoping to be near the peak here in states like Michigan and I think New York. But when we look nationally, there's still many states that are yet to peak.
7% of the population, 25% of the deaths. That is an astounding stat. What's the availability of ICU beds? Are you aware?
Right now, I was just, for instance, checking the stats at my own hospital this morning. It's we're down to very few beds overall, and quite a few patients waiting in the waiting room. So I'm hoping we're at the peak, but it's just been really tough. People have to stay vigilant, and now is not. I know we're all exhausted, heading into almost our third year into this pandemic, but people have got to get vaccinated, stay masked, and just be cautious.
800,000 daily cases we're seeing. So the faster Omicron spreads, the more opportunities there are for mutations. How concerned are you about a new variant down the road? We were clearly not prepared to handle Omicron.
Yeah. Unfortunately, every time someone gets infected, that's a new opportunity for a new mutation. And with so many people getting infected, there will be new variants. The question is just how virulent and how much they will spread. The good news is that it actually does not behoove the virus to kill the host because then it doesn't spread. So my hope is that we'll see evolution towards milder variants, but there is just no way to know, and unfortunately, anything is possible.
Yeah, that we have learned. This weekend, the U.S. Surgeon General told CNN State of the Union cases have not peaked nationally. Here's what he had to say.
We shouldn't expect a national peak in the next coming days. Next few weeks will be tough. But Jake, this is also why it's so important that we are surging resources to hospitals that are struggling. It's why it's so important that we all double down on precautions that we're taking.
What do you think of those comments? How far are we from a peak, and where could that be? Are we talking 1 million, 2 million daily cases?
So, I was actually just checking the models this morning. In some places, like I said, like Michigan, New York, I think the new case rates have started to slow down a bit. So I think we are getting near the top in some states, but we have to remember this started first in the Midwest and the East Coast, and the West is farther along. So it's going to take some time before those other states peak. So we probably know and are not at a national peak, but I guess the good news is that Omicron does seem to be spreading quickly. So our hope is that it'll leave as quickly as it came.
We're seeing 2,000 daily deaths recently. You recently wrote an article for the LA Times with the headline, "Lung failure leads to COVID tragedies, but lung disease was a crisis even before the pandemic." And in it, you said this: despite truly remarkable advances in our capacity to diagnose and treat disease in the 21st century, our ability to treat lung disease is still profoundly primitive and intensified by the pandemic. That deficit has tragic results. So what have we learned? What might we do differently down the road?
One of the things that really weighs on me greatly is we've had a lot of investment into new vaccines and treatments, but the problem is we had no way to treat severe lung failure to begin with, and we've not really seen the level of investment to figure out how to solve that problem. There will be another pandemic. This is not our first one. We need much better investment into diagnosing and treating severe lung disease than we've had in the past. And I think the pandemic really should serve as a wake-up call for all of us.
We hope so. We also need some consistency among administrations. It's unfortunate that we have one president and then the next it just completely drops off. It would be nice if we had a straight line there. Dr. Meilhan Han, Chief of Pulmonary and Critical Care for University of Michigan Health Systems. Great having you here. Really appreciate it.
Thanks so much.